from the Broadcast Center in Los Angeles, this is KCAL 9 News at 8 a.m.
And live in our red room, ER Dr. Patrick Shanovich with Dignity Health. He's joining us in studio next to tell us how to stay safe this summer.
Well, summer is in full swing, and while it can be a lot of fun, it's also important to keep yourself and your family safe this summer. Here now is Dr. Patrick Shanovich. He's an emergency room doctor with Dignity Health California Hospital in downtown LA. Welcome, doctor. Thank you so much for being here.
Thanks for having me on.
So as an ER doc, you see everything that comes through those doors. And I know summertime, my co-anchor Amy and I were just saying, there are a lot of injuries. Why so many injuries in the summer, and what do you see?
Well, I think it's a time when people are out and about, people are busy, and so a lot of what we see in terms of trauma happens to be with automobiles, with other injuries like bicyclists, and automobiles against pedestrians.
Okay.
And then there's the other things, of course, like the swimming-related injuries, drowning, near drowning, heat-related illness, and then head injuries. Those are all important things to cover.
Right. So you touched on drowning. I know, a lot of the kids are out at the pool. What are some tips for parents on pool safety? And you mentioned near drowning, but we hear so much now about dry drowning. So what can parents keep in mind as their kids are, in and around the water?
This became more important to me, I think, having a daughter now that's 7, but especially when she was young, it made me think a little bit more about it. We had a kind of a near-miss episode in a pool when I was visiting my sister. She was right in front of us on the ladder, and I remember looking at my sister, looking back, and my daughter was underwater, right? So we pulled her out. She was fine, but I think it really highlighted a couple of issues, especially the young children. They don't necessarily make noise. They don't struggle, and things can happen so fast you think you're actually watching them, and you really need to be eyes and hands on. And so overall with pools, it's important for the young ones to make sure we have life vests on that are approved. It's important to be directly supervising, and then other people using pools should be trained in swimming, right? Should have had swim lessons and be able to swim competently.
And what is dry drowning? Isn't that like secondary drowning? Is that right?
So this is a little bit complicated, I think, mainly from a terminology perspective. When someone drowns, their lungs can either be full of fluid or be dry because the vocal cords kind of close, right? It's hard to know when the person is pulled out of the water, which of those is occurring. I think more important from like a parent perspective would be to recognize symptoms that could be dangerous. So any child that's required rescue from being submerged probably should be seen by a provider. Anyone who has a persistent cough, complains of shortness of breath, or looks short of breath, or especially those that are confused, should be seen by a provider. Those are kind of the bigger issue, I think, than just defining what dry drowning is.
Got it. So really keep an eye on them even after they're out of the water and make sure that everything seems okay.
Exactly, because it can be delayed, right? It's not something that happens right away. Sometimes it can happen a few hours later.
Right. And of course, the kids are out on their bikes, the ATVs, the skateboards. What should parents be thinking of in terms of safety when it comes to those things?
That's a great question. And kind of like what I referred to before, a lot of what we see in the emergency room happens to be accidents or injuries related to motorized vehicles. As an adult and a driver, I think we need to remember that kids are out and about and basically less predictable in the summertime, so we should drive more defensively. As a parent, I'm going to want my daughter to have a helmet on, to practice and train appropriately for whatever activity she's doing, if it's a bicycle or skateboard or whatever else, and then to be supervising her in the appropriate manner.
I know even a lot of the older kids don't want to wear helmets, but I think it has to be a non-negotiable, right?
Exactly, yeah, helmet for sure. And even with a helmet, you can have a head injury, so it's important to recognize if a kid does hit their head, if they're having a pretty severe headache, if they're confused at all or repeating questions, those are symptoms that are pretty concerning, and somebody who's trained in recognizing head injuries should evaluate them.
Okay. And in many parts of our viewing area here in Southern California, we get pretty hot up in the high desert, the Antelope Valley, 110, 115 degrees, heat stroke. That can be a major concern. What advice do you have for parents and kids, doctor?
It's a good question. I tend to look at this to simplify it a little bit in the terms of who's most at risk, right? And so those that have a harder time kind of managing their own body heat are the very young and the very old. So obviously we want to keep kids out of being locked in cars, right? That's one that we see, unfortunately. And then the elderly adult that doesn't have air conditioning, that's trapped inside their home, may not be able to get out or hydrate themselves. Just in general, we want to stay protected from the sun. So appropriate sunscreen, loose-fitting clothing, staying out of the sun in the middle part of the day, a couple hours before and after lunch are all good ideas, and then staying hydrated.
Yeah, and I always hear drink water before you're thirsty.
Exactly. Yeah.
Yeah,
And it's a lot more water than you'd think. It's if you're active in the sunlight or active in the heat, you want to make sure that you continuously drink water.
Great. Good advice, doctor. Thank you so much. Wishing everyone a healthy and safe summer. To learn more about Dignity Health, just go to our website, kcal9.com, and click on Seen on TV.